Alright, so today I will be doing some trach care. Um, with this checkoff, it includes suctioning of the trach tube, so it'll just be from right here, and then it also involves cleaning around the stoma and replacing gauze. So some of the equipment I would want to have is a trach tracheostomy care kit. I gloves, but there should be some sterile gloves in the care kit, at least the one I have. And then you want to do some peroxide, some normal saline. Um, what am I missing? Spare inner cannula if it's disposable. Um, well, you want a spare inner cannula, and then if it's disposable, you want a disposable cannula to replace the one that you're removing. So when we're suctioning, I have no way to demonstrate at the moment, but you're gonna uh, basically insert the catheter. So let's say this is my sterile hand. I don't have gloves on right now. I should, but um, you'll use your sterile hand, so it'll be your dominant. So my dominant's my right, and then I'll pretend these are sterile gloves, and then my left hand will be my non-sterile, and that'll be the one that's holding the catheter or the suctioning. So you'll put this catheter into the tube, go until you can trigger a cough, and then you'll pull back a little bit, and then you can occlude the opening of the suction catheter and start pulling back all the way out. Um, you can just it'll remove any secretions that are stuck in there. Um, so clean that out, suction, and then we can move on to cleaning around the stoma, which will is where the care kit really comes in. So this kit comes with basically a sterile field. You can lay this out. Um, yeah, you can lay that out as long as it's not contaminated. Any contaminated areas you can't use, obviously. But it'll come with some gauze that's already cut to be replaced, some cotton swabs, um, something to scrub with, and then some pipe cleaners to kind of clean out the inner part of the cannula. So we'll begin by, so we've suctioned, so we'll fill the basin right here with peroxide. At least I'll use the bigger one for the peroxide, and then over here we'll put some normal saline. And so we'll start by removing the old gauze, discard of that, and we'll remove the cannula and replace it with a temporary one with a red top cannula, and that'll cover that up. And then you'll put the other cannula, it's not disposable, so you'll place it in the peroxide. You'll scrub it really well. You'll use the normal saline to rinse it off, get all that peroxide off. Once that's all clean, you will replace it, put it back in, and then you will begin by you'll clean the stoma, so you go in and out. So you use these okay. So then you'll just use these with you can use peroxide, and you'll just kind of go in and out, kind of around the stoma, clean it. Once it's all cleaned, there's no gunk stuck there. If there's any at all, you'll replace the gauze, and then you'll cut the ties. Let's see what they're called. They are called tool tape, which will you'll cut. Make sure not to cut the pilot tube. Let's see. And then you will replace it, and you will basically just knot it off. Make sure it's comfortable on the patient's neck, at least a finger should be there or in between. That way it's not too tight, because you never know how the patient is feeling. That's a good way to kind of ensure that there's no over tightening. Um, let's see what I'm missing here. After that's all done, after they're cleaned up, this actually also comes with a spare gauze. It's not cut at all, and you can kind of use this to. Actually, comes with two. You can use it to clean up anything that kind of still around. Just to get it off there. That way, it's not just sitting there. Um, Once it's all cleaned, you will then just discard of all the waste basically, and just kind of remove your gloves, wash your hands, make sure the patient is comfortable. They're okay. Anything that was taken off is replaced, and that's about it.